Lift the Label is a campaign to remove the stigma that prevents those with addiction from seeking effective treatment. Welcome to CBS News Colorado Community Conversation. I'm Karen Lee. We know that support is one of the most powerful forces on the road to recovery. That's why we are devoting this community conversation to answering questions about addiction, the impact of stigmas, and learning how recovery is possible with the right treatment. Charlotte Whitney is Deputy Communications Director for Colorado's Behavioral Health Administration. Thanks, Charlotte. Thank you so much for being with us right now.
Thanks for having me, Karen. I appreciate it.
We certainly appreciate it, too. The Behavioral Health Administration, we know, is overseeing this initiative. Charlotte, can you first describe to us how you came about with this title here, what you're trying to accomplish with Lift the Label?
Yeah, so Lift the Label started out in 2018, and really the goal was to be responsive to the opioid crisis that's still going on today and was coming forth in 2018 and growing. And so we had federal funding at the state to work towards improving the opioid crisis by providing treatment. And one of the data points we looked at was stigma is a huge barrier to people seeking treatment. And one of the most effective ways to reduce stigma is to show people that recovery is possible. And so we do that at Lift the Label by sharing the stories of real Coloradans who are in recovery and their friends and family who support them every single day. So Lift the Label really came out of needing to reduce stigma and sharing out those stories.
Yeah, and Charlotte, speaking of that stigma, we often say, you know, this is what addiction looks like, but it really impacts everybody, all ages, all careers, all professions.
Yeah, there's no one type of person who falls into that category. Really, it's important to share that, you know, addiction is not any one type of person or any one type of experience, but, you know, addiction is not a moral failing. It is not a choice. It is a treatable medical condition. So for any folks who are affected, it's really important to look at it in that way and treat it as such.
We talk about the crisis, of course, with the people that are addicted, but what about the family members and coworkers and people that love their people, right? How can they rally around someone that's trying to seek recovery?
One of the huge things they can do is understand what treatment resources are out there. It's really helpful if someone comes to you and says, hey, I think I need help. I'm concerned about my substance use, that you know how to help them. And so we really encourage people to understand the treatment resources like OwnPath, which is a treatment locator that's available online at ownpath.co. You can find treatment near you right here in Colorado. It shows all of our licensed treatment providers. That's one really huge thing. The language we use is also really important. So making sure that when we're talking about substance use and addiction, we're using person-first language, so really making sure to not call people addicts, because that's pretty stigmatizing and also is one of those labels we're trying to lift. And so to make sure to call somebody, perhaps, you know, a person experiencing substance use disorder or a person experiencing addiction, separating the person from the behavior or the diagnosis. And
is that the same as I know BHA is launching some free resources. Is that the free resource that you're referring to?
Well,
like
yeah,
the website?
one of them. So OwnPath is one. The other that we are promoting right now that we're really excited about is called CRAFT. CRAFT is an acronym that stands for Community Reinforcement and Family Training. And what that does is provides support to friends and family members who have someone in their life who may be experiencing addiction and struggling with it. And what it does is it's not just a support group where people get together and chat, although that's an element of it, is like getting support from people who are going through a similar experience. We also, the CRAFT group will teach skills like setting healthy boundaries, having positive communication, which sometimes may be lacking in those situations where you have negative communication, things are stressful.
Yeah, for sure.
Setting that up and really feeling, giving friends and family feelings of support through understanding how to set those boundaries and how to support the person they care about. And it's really effective. The research on that model shows that 7 out of 10 folks are able to engage their loved one into treatment simply by participating in CRAFT and understanding those skills.
Yeah, being kind and being able to communicate, right? Yeah. Communication is so important all the way around. Your campaign says that for recovery, of course, is in reach for anyone. Let's talk about why that is so possible.
It's possible because we're really trying to promote the message of support and making people aware of all the treatment resources that are out there and available. And I understand that cost is absolutely a barrier that comes up when we talk to people about maybe their hesitations around pursuing treatment. And in Colorado, we have a grant that helps people fund their treatment if they're underinsured or uninsured. So it's really important that people know that they can call any treatment facility. They'd love to help you out and try to not let costs be too much of of a barrier. Like, there is a cost to it sometimes, but they really do want to help you out, and will talk you through what your payment options are so that they can get you the support that you need.
And there's so many different steps to recovery too, right? Not every person is the same and needs the same extent of types of recovery.
Right.
So the price point would vary.
Exactly. Not people think of recovery or treatment as, you know, the 90-day stay away, and that is needed for some folks, but other people, it's more of a outpatient setting where you can drop into your local treatment facility and get the care that you need and go back home and go on with your life. So recovery looks different for everybody.
Yeah, skills. Have to learn all the skills, right? Let's talk about these recovery cards. Lift the Label works with the artist on recovery cards. Can you tell us what all this is about?
Oh, yeah. Recovery Cards Project has to be the most amazing thing I've ever had the honor of being a part of. What we did here is we went to the recovery community and we asked them, what did someone say to you in your moment of need? What did really, you know, what was the encouraging word you heard, or what do you wish somebody had said to you when you needed help or when you were seeking treatment? And so we took all of those messages from the recovery community and went to artists. And so we worked with 10 artists in the very beginning. We have more now, but we worked with artists from Colorado and nationwide, and gave them those messages we heard from the recovery community and said, go forth and make art. And so what's come together here is a really amazing product, if you will. Greetings are a time-tested, thoughtful gesture that we all go to a store and get a card if we want to congratulate someone, wish them happy birthday, but also they cover grief and loss. So we don't always have to have the words. That's what the card is for, and that's really what Recovery Cards helps people do, is put the words of encouragement in the hands of someone so they can give support even if they don't know what to say. And that's really the feedback we've heard on Recovery Cards, was that it means more to them than a text. If we had one person say, if I would have seen this in my moment of need, it probably would have gotten me into treatment sooner. I probably would have, you know, decided to seek help simply from this act of support by getting a card.
And especially knowing that these cards are written by people that were sitting in their same spot at that same time in their lives. And it really, really opens the door for recovery. Charlotte, thank you so much for being with us today. We so appreciate all of your time and attention to this. You're so, so, so grateful.
Thank you.
When we return, we are going to hear from an educator sharing his own journey of recovery while helping others. We are back with our community conversation about our state's efforts to lift the label, removing the stigma around addiction, and championing effective treatment. Joining me now is Keith Hayes. Keith is the Director of Recovery at 5280 High School. Keith, thank you so much for being with us.
Thank you so much for having me today.
Yeah, we appreciate your time for sure. We want to start with Keith's own journey. You've said that breaking free of shame and guilt is what got you yourself on the road to recovery.
It was, and I had to be beaten into a state of reasonableness. I was in active addiction for a long time, and for a long time there, I didn't even realize that I really had a problem. I was really good at always passing the blame on somebody else, not taking responsibility for my side of the street, not taking accountability for my actions. And because of my addiction, I lost my family, I lost relationships with my mom, and I had caused a lot of harm to a lot of people that I cared about.
And you lose a lot of time, right? You lose yourself, of course, within that span of years.
You do. You lose your humanity. You do. You lose your humanity. Before I knew it, my addiction, it made me homeless. I was living on the streets. I was selling dope. I was doing dope. And I was also on probation at the time as well and was on my way back to prison.
Let's talk about those relationships. Where are you now with your mom? And now within your recovery, what is your relationship like now? We
have the best relationship we've ever had. I'm so grateful for her. And she had to make some very difficult decisions with me. And she had to you know, kind of put her arms up in the air and say, hey, I can't help you right now, son, until you're willing to help yourself. And that's some of the greatest things that she's done for me. And she just prayed for me while I was out in the streets and doing the things that I was doing. And she was just hoping that I would find my way. And when that time came and I was ready and I made a decision to want to recreate my life, she was there for me with open arms. And without her, I would not be here today.
We were talking earlier, too, about the support of our loved ones and how important that is. But let's talk a little bit about, since you yourself have gone through this, so often family members think that they're the ones that can make that person change and make that person seek recovery. It's not always the case.
It's not. And my mom realized, like, she could not enable me anymore. And she had to say, you got to get your own experience. I love you, but I love you from a distance. And she wasn't the reason why I was out doing drugs. I was the reason. And it's about accountability. It's about taking responsibility and owning the fact that I have a problem. And the only person that can do something about it is Keith, not my mom, not anybody else. And it was so important to me in my journey that I took responsibility for my actions and I made a decision to recreate my life.
Let's talk a bit about recovery.
Yeah.
And I know it probably looks different for every single person, but you know, once someone gets into it, I mean, often they want to know, okay, I'm going to go and get fixed, right? But that's not always the case either.
No, no. You have to make sure that you're ready. Mm-hmm. You have to be ready, and you have to be ready to put the work in. It's work. It's not easy. It's not easy. And it starts with being honest with myself. And I had to admit that I was an addict and an alcoholic of the hopeless variety. And that I was going to have to live and do things differently if I was going to truly change. And for some people, they try recovery and they relapse and they relapse and they relapse. And then sometimes it finally sticks. And this is my first time at recovery. Relapse is not a part of my story. I'm very grateful for that. And that's why it's so important that we show up and do things like this. And we need to recover out loud so we can give hope to somebody out there that they can recover too.
Yeah. Let's talk about the young people that you're with and that you lead at 5280 High School. How important, I just makes my heart so full to know that these kids have a safe place to go to talk about recovery and to be sober.
Yeah.
This is just fantastic. So let's talk a little bit about the kids. What do you see right now with them and what are they up against?
Sure. So 5280 is a recovery high school here in Denver, Colorado that serves students specifically who struggle with substance abuse. Mm-hmm. And it's so very important that we have this school. It's critical to our community. We are in the worst drug crisis that our country has ever seen. And it's important that they have a safe space where they can show up, get their education, learn about recovery, learn about the principles of recovery like honesty and courage and integrity and willingness and humility. And most importantly, to meet a new peer group they can surround themselves around who have also got sober, who have also changed their lives, that can give them some hope when they first come through the doors that, hey, maybe I can do this too. And I can have a life now full of purpose at the age of 15 years old, 16 years old, etc.
Tell me what you see from the beginning of the year to the end of the year. What do you see? How do you see these young people change? Man,
it's so phenomenal. It is. You see them come in. A lot of them, some don't want to be there. They cannot picture life without drugs right now, right? And I see them come in and they struggle sometimes at first. And then I see the lights start to come on. I see them put together a week sober. I see them put together a month. I see them put together 90 days. Now all of a sudden they got 6 months, right? They're excelling in the classroom. They're growing. Now they're helping others, right? And now they realize that they have a life of meaning today and that I can live life one day at a time without using. And that is so awesome because if we can catch them now as teenagers, they don't have to make some of the same mistakes that I have made in my life.
How important is it to share these stories, for these young people to be able to share their story with the people sitting next to them and for you to be able to share your story with them?
It's part of the circle. It's part of what we do. I can't freely keep what I got if I don't give it away. And they feel the exact same way. So it's important that we suit up and that we show up and that we all do our part. Mm-hmm. I have a responsibility to those that came before me and those that will come after me to recover out loud and to help as many people as we can. That is our life's mission today. That is my purpose. That is what God brought me through all this for. I believe that without a doubt. And it's important that I continue to do this work until that's all I have left.
You were talking about your mom a few minutes ago, and we were talking about support groups. What do you want to say to other young, like the friends of these young people that are in there seeking recovery, and also to their family members and their loved ones that love them so much and want to see them stay sober too? What do you say to them right now that you have an audience with them?
You no longer have to live in terror, frustration, despair, hopelessness, that their recovery is possible, that there is a solution, that you are not alone, that we are here for you. There is all kind of treatment options out there. There are support groups you can get into. There's a lot of different ways to find recovery, multiple pathways. And just know that there's hope out there today. And that to the families of the loved ones, just know that it's not that they don't love you. It's not that they don't care about you, but they are in the grips of a fatal and progressive disease. And we have to continue to pray for those individuals. And when that time comes and they need us to support them, that is when we need to be ready, because sometimes it's at that one moment where they had that willingness to make that change.
And they got to take it.
Yes, ma'am.
Keith Hayes,
Yes, ma'am.
thank you so much for being with us. We appreciate your time and sharing your story with us. It's just so powerful.
I appreciate it.
And of course, when we return, we will zero in on treatment with a doctor, a physician who specializes in recovery. Research indicates that medications are the most effective treatment for opioid use disorder. Here to share more insights on this is Dr. Kaylin Klee, a family and addiction medicine physician. Dr. Klee, thank you so much for being with us today. We appreciate it.
Yes, thank you for having me.
Yeah, we really appreciate it. We wanted to start first by describing at a really high level, physiologically, the nature of addiction. What happens to the body and the mind?
Sure. So our brain, when exposed to a wide variety of substances and experiences, has chemical changes. It releases neurochemicals that teach us about that experience, whether it was pleasurable, whether it helped relieve symptoms like depression or anxiety. And then it trains our brain to seek to do that experience again. And so we call that the chronic brain disease, or the biologic model of addiction. For most people who experience substance use disorder, there's a component of physiology, and there's also components of genetic history, family and environment, and then personal experiences such as trauma, mental health, pain, that contribute to whether one person is more vulnerable to developing a substance use disorder compared to another.
Dr. Klee, let's talk about the medications that are often used to fight opioid addiction. How do they work, and why are they considered to be one of the most effective tools?
Sure. So medications for the treatment of opioid use disorder, what we now call MOUDs, really have been shown to be the most evidence-based intervention. That is from studies showing that people who receive medications, and there's 3 medications, methadone, buprenorphine, and naltrexone, that have been FDA approved for the treatment of opioid use disorder. When we look at folks who are able to become sober, stay sober, and then enter long-term recovery, as well as people who have reduced harm related to opioid use, reduced infectious disease risk, reduced overdose, and definitely reduced death, the people who receive medications as part of their treatment have much better long-term outcomes, specifically reduced overdose and reduced overdose death.
And Dr. Klee, is there a question for you too when it comes to the treatment? A lot of people may ask too, am I going to have to be on these medications long-term? Is this something I'll have to be on forever? Or is it just part of the process? And it can be part of the process.
Sure. It's each individual person. That is the question that we want to answer during that person's treatment is, what are the pieces of this person's treatment, medication, length of treatment. The data is super clear that the longer people engage in medication treatment for opioid use disorder, the better their long-term outcome is likely to be. We used to have this idea that we should only use medications for the shortest period of possible detox, right? Helping people get through withdrawal symptoms, but then not continue treatment. And that has shown to be, unfortunately, a harmful approach to the treatment of opioid use disorder, and that continuing medication longer term, months to years, and for some people that may be a lifelong treatment, has been shown to be much more helpful in preventing return to use, preventing harm related to use, and then preventing premature death related to opioid use disorder.
Dr. Klee, we've been talking a lot about the importance of patients having support groups and just really having people rally around them. As a doctor and seeing this in your patients, how important is it, as you watch, for people to have support groups?
It's critically important. Often one of my questions after we get through an initial history, an initial discussion of what is this person's goal in treatment, what are they looking to achieve, is who else is with you, right? Who's in your home? Who's in your community? What places do you have that you can receive support, that people know about your efforts towards recovery and are supportive? It is very challenging to be the only person in your family, in your community, seeking sobriety. And so often I'll encourage people to reach out to friends or family maybe they've lost touch with while they've been in active use, but may be supportive of reconnecting and rekindling that relationship as part of their recovery. And then, of course, meeting people who have walked in that same path, connecting to people in recovery, people who are looking at all their options as far as treatment, all along that continuum. There's so much importance in helping people develop those connections.
Yeah, seeing where they can be in the future too, right? That's so important. Hope for the future. Let's talk a little bit about the language that we use. Why is it so important, the words that we use and what we say when it comes to reducing stigma?
It's so important for a variety of reasons, but one of the main reasons that I think it's incredibly important is not only to reduce stigma and the experience, hopefully, of that person who's receiving treatment, right? Receiving treatment in a much more destigmatized, hopefully supportive way that will promote and support that person's ongoing recovery. But I think for the wider community, and definitely for the healthcare community, many people with substance use disorders have not had positive experiences in the healthcare setting. And so I feel particularly passionate that the healthcare community really owes our patients with substance use an apology for the treatment that they may have received and our commitment to do better. And part of that really is using person-first language, not just less stigmatizing language or what people sometimes think of as politically correct language, but really promoting personhood first. And so instead of saying alcoholic or some other terms that even are more offensive, using words like person with opioid use disorder is important to that person, to demonstrate I see you as a person first and having this particular condition as a feature of who you are, not the whole of who you are as a person. The other part that is so important is for teaching our healthcare workers to do better and be different in the future. And so I had the opportunity to teach students, residents, fellows who are learning. And each time those who are in that learning environment hear their attendings, hear their faculty use language, they are learning how they should talk to their patients in the future. And so the more that we use person-first language, my hope is that that will have a ripple effect of really changing the culture around the way healthcare providers approach people with substance use.
Dr. Klee, Kaylin Klee, thank you so much for being with us. Really, really beautiful work taking place here. We appreciate it. And thank you so much for watching this conversation about Lift the Label, aiming to break the stigma around addiction. And remember that support is one of the most powerful forces in recovery. You can find many more resources on CBS News Colorado.